What is a slap tear or a tear of the labrum in your shoulder? What signs and symptoms could tell you you have this injury, and what treatments can help you recover? We're going to talk about all that in this video. I'm Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. Slap tears are one of these injuries of the shoulder that have been recognized more and more over the last 10 or 15 years. Back in the early days, especially before MRIs and shoulder arthroscopy surgery, you would never really hear much about these. But with MRIs and especially MR arthrograms, these have been recognized as more important and more common injuries. Basically, if you look at my shoulder model here, and I don't know how well it shows it because I can't pull the ball away from the socket, but the labrum is the cartilage bumper along the socket. And a slap tear is by definition a tear of the top of those, where the biceps tendon, which is not really shown, well, it is sort of shown on here, basically goes in and attaches to the top of the labrum. SLAP is an acronym for superior labrum anterior to posterior. And so it's a tear of the labrum at the top of the shoulder. Typically, you see these in a repetitive overuse mechanism in throwing athletes, specifically baseball pitchers, but in theory, it can be any type of repetitive overhead motion like a tennis serve or volleyball, that type of thing, but not terribly common. You can also injure the labrum, albeit not just the superior labrum, but sort of anywhere along it with a traumatic event. That can do it as well. A lot of times, especially in manual laborers and people as they get older, they start having pain that turns out to be labral tear, but they may not remember a specific event. Typically, people, maybe easier to show, not on the model, but people with this complaint, a lot of times especially, will tell me they're not sure exactly where it hurts. It's just somewhere deep in the shoulder. That always sort of typifies, hey, this may be a labral tear. Sometimes you'll notice a clicking sensation very deep inside the shoulder where the ball sort of catches on that labrum and and elicits that clicking sensation and pain. Now, as far as treatment goes, typically what orthopedic surgeons will say is that it's something that needs surgery. And the argument is that labral tear on its own, very similar to a meniscus tear, isn't going to spontaneously heal itself and become a normal labrum. Now, there is a fairly good success rate with non-surgical treatment for slap tears, for labral injuries, especially slap tears. But the thought is that the reason that might be successful, and again, that's usually time and maybe anti-inflammatories and physical therapy, is that the labral tear itself wasn't necessarily the source of pain. That can be very tricky. As far as diagnosing it, there's some physical exam tests that can tell an orthopedic surgeon, hey, this is likely to be a labral tear, but typically you need an MRI. And what I expect or believe to be very helpful more than just a plain MRI is what's called an MR arthrogram, where a radiologist injects a little bit of dye or contrast into the shoulder and then gets an MRI, and that contrast travels up into and under the labrum to show that it's torn. If it needs surgery, and again, in younger, active, especially athletes, that very often does, the surgery can be one of two things. Very often it's going in and reattaching that labrum to the socket with anchors and suture anchors to get it to hold in place. Sometimes, especially in manual laborers where it's more just a degenerative tear and it's not detached from the socket, you can just go in, take a shaver and smooth that out. And that's enough to sort of get it to not be painful. There probably isn't that much of a role for regenerative treatments in this, things like PRP or exosomes or stem cells. Maybe the PRP or exosomes, maybe that might help the repair, the reattachment with the sutures and anchors heal faster or heal more reliably. People sometimes ask me about peptides, whether it's BPC 157 or TB4, TB500, which is thymosin beta 4, or something like CJC 1295. Maybe that would help you recover from surgery faster, helping everything heal a little bit faster, but more importantly, getting the strength and the muscle back a little bit faster. Maybe there's a role there. But I would argue, one, those are experimental or off-label, and I'm not promoting those, but maybe there's a role. But you can do very well with that surgery even without any of that. Just know it's a lot of time and a lot of patience, getting that labral repair to heal, and then a lot of work with physical therapy, getting motion back, getting strength back, getting your overhead and your functional ability back can take a long time. Yes, it's an outpatient surgery, but it can be 6, 9, sometimes 12 months before that shoulder feels like it did before you suffered the injury. So I'd love to hear your experience with your shoulder injury. Leave those in the comments below. Please understand I can't offer you medical advice, but I can try to answer your question in a future video. Make sure to subscribe to my channel, click the bell to be notified when I release a new video or start a new live stream like my Ask Dr. Geier live shows. And if you have knee, hip, shoulder, or some other bone or joint pain and you want to get significantly better in the next 30 days without cortisone shots or without surgery, you can learn more about working with me in the description below. Thanks for watching. I look forward to helping you feel, look, and perform better than ever.